Which cranial nerves are represented in Riolano'S bouquet, or you can say Riolan bouquet? Options are A. Ninth, 10th, 12th, B. 7th, ninth, 12th, C. 5th, 7th, 12th, D. 5th, ninth, 11th. So answer of this question is B. 7th, ninth, and 12th. This Riolano'S bouquet or Riolano'S cordon, or you can say styloid apparatus, is formed by the styloid process, three muscles and two ligaments. Three muscles are Styloglossus muscle, Stylohyoid muscle, and Stylopharyngeus muscle, while two ligaments are Stylomandibular ligament and Stylohyoid ligament. First muscle is Styloglossus muscle, which arises from the anterior one third, lower one third of the styloid process, which insert on the side of the tongue. It is supplied by hypoglossal nerve that retract and elevate the tongue, while the second muscle is stylohyoid muscles, which arises from posterolateral part of the styloid process and insert on the body of the hyoid bone that supplied by the facial nerve that elevate and retract hyoid bone during swallowing. Third muscle is the stylopharyngeus that arises from the posteromedial part of the styloid process and that insert on the pharyngeal wall, and it is supplied by the glossopharyngeal nerve and that elevate the pharynx during swallowing. So there are three muscles which supply by the different three nerves. Nerves are 7th, ninth, and 12th. So that will be the answer. While there will be two ligament, stylomandibular ligament that arise from the tip of the styloid process and insert on the angle of the mandible. Second is stylohyoid ligament that tip or origin from the tip of the styloid process and insert on the lesser corner of the hyoid bone. Anatomical relations. External carotid artery runs deep to the muscles of Riolano'S bouquet, or retromandibular vein runs superficial to all elements of styloid apparatus. So, external carotid lies deep while the retromandibular vein lies superficial to the styloid apparatus. Clinical importance. First is Eagle syndrome. It is because of elongated styloid process or ossification of stylohyoid ligament. Symptom may be pain, rapid otalgia, and foreign body sensation in the throat. Second is carotid space surgery. Styloid apparatus serves as key landmark in skull base and parapharyngeal space dissection. Third clinical importance is parapharyngeal tumors. Muscular bundles help identify neurovascular displacement pattern in the parapharyngeal tumors that are into pre-styloid or post-styloid component. So this is the Riolano'S bouquet. You can see this is the skull base. This is the styloid process. There are three muscles arising from this styloid process. Anteriorly, which from the lower one third is the styloglossus muscle, which goes to the tongue and that supplied by hypoglossal nerve. Second muscle is the stylohyoid that going from the posterolateral part of the styloid process going into the body of the hyoid bone that supplied by the facial nerve. Third muscle anteromedially is the stylopharyngeus. That muscle is going like this in the pharynx, parapharyngeal space, which insert on the pharyngeal wall. That is supplied by the ninth nerve. So three muscles: styloglossus, stylohyoid, and stylopharyngeus. So nerve will be ninth, seventh, and 12th. Well, there is two ligament. A stylomandibular ligament that arise from tip of the styloid process going into the angle of mandible. Here, this is the mandible. While the stylohyoid ligament is coming from the styloid tip of the styloid process going into the lesser horn of the hyoid bone. So this whole complex is called Riolano'S, Riolano'S bouquet. Okay, so this is the whole concept of styloid apparatus.